They covered it up. They covered the whole story up.
Tonight, Target 8 reveals what really happened in the moments leading up to the death of a grandmother at a Kent County nursing home. Family members thought that she had died peacefully in her sleep.
But Target 8 investigator Ken Kolker uncovered reports of a clogged breathing tube and a nurse who let it slip her mind. He joins us live in studio tonight. Ken?
Yeah, Brian and Sue, records show the details of her death went unreported by Kent County's biggest nursing home, a home operated by West Michigan's biggest medical provider, Spectrum Health.
She was not ready to go. It wasn't her time.
But 77-year-old Barnell Gunter, a grandmother, a mother of 6, had been sick for years. She had suffered a stroke, was diabetic, had dementia, schizophrenia, and needed a tracheostomy tube since her heart attack 2 years ago.
That's the only way she could breathe.
Doctors' orders show she wanted the nursing home to do everything it could to keep her alive, including suctioning the trach tube so it wouldn't fill with mucus.
It was kind of sad to see her diminish, in her health. The sicker she got, she wasn't as spunky as she was.
She was on the second floor of Spectrum Health Rehab and Nursing Center, the old Kent Community Hospital. With 278 beds, it's by far the biggest nursing home in Kent County. But it's also one of 3 in the county out of 25 to get the lowest rating in state health inspections, much below average.
She was talking just fine the day before it happened, so I know she was in good spirits.
Which is why she says the family asked the state to investigate after learning she had died early in the morning on August 30th. The woman who was close to Gunter did not want to be identified.
They covered it up. They covered the whole story up. They don't want the truth to come out. Because if the truth come out, then they know they're going to get in trouble.
A complaint was filed 20 days later to the state agency that monitors nursing homes. But state officials told Target 8 it was not self-reported by Spectrum. The state investigation revealed new details of Gunter's last hours. State records show a certified nurse assistant was filling in on the short-staffed second floor on August 29th. When she checked just after 11 that night, Barnell appeared restless, moving her head back and forth. Her trach tube, quote-unquote, sounded full. The assistant told the registered nurse, who said she would suction it. But the RN was busy with a patient who had fallen, and later told the state, quote-unquote, it just slipped my mind. 2.5 hours later at 1:40 in the morning, she checked on her. Gunter wasn't breathing. She had no heartbeat. It's possible, says Kent County's medical examiner, that she suffered that night in her room.
If they are alert and suddenly are unable to breathe, then I think it could be uncomfortable.
The ambulance paramedic who treated her told the state, quote-unquote, no one seemed to know when or how the trach came out or for how long it had been out. Gunter died despite rescue attempts at the home and at Butterworth Hospital.
This death certificate lists the cause of death as natural, making no mention of a trach. A separate medical examiner's report does mention a trach, but only to say it became dislodged during respiratory distress. It makes no mention of a clog or a delay.
We should be told, our investigator, from the get-go, what happened, everything that happened.
If they'd cleared that blockage, could she have survived that?
She could have. She may not have died right when she did. She may have lived minutes longer, a day longer, maybe several weeks. I would assume she's in pretty bad shape if she's, in that situation, but she probably wouldn't have died when she did.
The feds fined the home more than $24,000 for putting residents in immediate jeopardy. They also withheld Medicare and Medicaid payments for new patients for 7 weeks. Probate court records show the nursing home settled with the family for $150,000.
The issue is what seems to be neglect on the part of the nursing home. They didn't report it to us, and as the ME, that's my biggest concern. I want to know stuff, and I don't care who it is, what institution it is. I'm wearing my medical examiner hat. I work for the county, and this goes into a report that's a public record.
Cole said his office, which investigated the death, likely would not have changed the cause of death from natural, but may have included the blocked airway. It also would have immediately reported the incident to the state.
There may be mistakes, but okay, if there are, report them. Get them out in the open, or at least get them to the state agency. Hey, we screwed up.
They should be fired immediately, and they should be prosecuted. That's how I feel. Because if it was their loved ones, they'd feel the same way.
A spokesperson for Spectrum Health responded, writing, quote, I can now confirm that we did not formally self-report. but we did fully cooperate with state and disclosed information. We also reached a settlement with the family and implemented a preventive action plan that was reviewed and accepted by the state. Spectrum also said it regretted the unfortunate death and that it had expressed its sympathy to the family. I'm Targeted Investigator Ken Kolker.